WVGA.
All right, back on the Morning Drive, 105.9 WVGA, 229-241-1059. That's the number to call, but we're going to take a little bit of break from the phone calls, and we're going to talk to the folks from South Georgia Medical Center. Erica Bennett contacted me the other day, and she's got Dr. Dawson in here, Dr. Dawson in here to talk about COVID-19 specifically. We've got the good news that the vaccine is upon us, and you've got an update on that, I think, Dr. Dawson.
Yes, sir, I do. We understand in the state of Georgia that by the end of the year, probably before Christmas, that we should have about 900,000 doses that will be coming to us. Now, of course,
now that's coming to SGMC.
It's going to be coming to the state of Georgia.
Okay,
right?
gotcha.
It's coming to the state of Georgia. And so 900,000 doses, so roughly 1 million. But, of course, then that will be enough that will vaccinate about half that number of people, right? Because you have to get 2 doses per person.
That's right.
So we, at some point this week, we're supposed to receive a survey from Pfizer, which is the company that makes it, to give them the number that we would like to have allocated. They base that off of the number that we get allocated for influenza. This year we had about 7,000, and we've been advised to ask for a little bit more than that. So we're probably going to ask for about 10,000, and of course, whatever we get, it won't come all at one time, so we will have to prioritize as to who will receive it. But we're hoping that we'll be able to start giving injections certainly before the end of the year, and hopefully before Christmas.
As far as prioritizing, I'm assuming that you're going to and I think this would be prudent. I think your staff at SGMC is going to be looked at first. Am I pretty much on path with that?
Yes, sir. You're correct. They do have a tiered approach that we're going to follow from the Department of Public Health, which has been it's being guided by the CDC. And so those people that are in Tier 1A will be healthcare workers and residents in long-term care facilities.
Okay.
So for those folks that are in long-term care facilities, they are the very most vulnerable population. And of course, when I say healthcare workers, it's healthcare workers / first responders, law enforcement, firemen, because a lot of times they interact closely with people, and we need that for the public safety. And of course, even in the emergency department, in the hospital, we'll end up prioritizing certain areas such as the emergency department as opposed to, say, medical records, for example.
I got you. So, I'm sure a radio show host is probably far the list, I would think. But, I mean, I can spread this all over the radio. I want you to tell me or explain really quickly to the audience. I think sometimes there's a confusion between what a vaccine is and what a cure is. This is not a cure for COVID-19. This is a vaccination to keep you, hopefully, from contracting the virus. Is that right? That's
correct. So vaccinations or immunizations, those are very important to help us, to prevent us from ever having a disease. As I tell people, it's the best intervention because then you never even get it. And when we look at the impact that vaccines have had on the population, or as far as the life expectancy of people in the United States, it's the third most influential thing as far as extending our lifespan here in the United States.
Wow!
Behind clean food and clean water.
Sure.
Vaccines have a very large impact. In particular, the first 2 that have come out from Pfizer and from Moderna have proven to be particularly effective.
I want to talk about the efficacy of it right quick. The numbers I hear in the media are about 90% or so, 92%, depending on which company has it. Compare that to the influenza vaccine and its effectiveness. I understand that each year they're a little bit guessing a little bit on the strain, but on average, I guess it would be the question, how effective is the flu vaccine annually compared to this?
So generally speaking, I mean, and it, as you say, it varies from year to year. And if you look at an average of a given 5-year period, it can vary a little bit, but it's usually at about 70 to 80%. One thing that is particularly unique about these particular vaccines that have come out from the companies Moderna and Pfizer is that they use a new technology called messenger RNA, and that's one reason that they've been able to have this higher degree of efficacy, and it comes out to be 95%. So
wow.
in the Pfizer study, they studied 43,000 people. And of those 43,000 people, 170 people contracted COVID-19. And of those 170, only 8 of those had received the virus. So it's about 4.75%. So probably about 95.25% efficacy for that for the vaccine.
Wow.
So It's very unique in the fact that it uses a different technology, and whereas in the past we've used kind of like parts of viral particles or attenuated viruses, this is something that's very different. That basically, I say very different. It's different in that you inject it, and then it goes and it starts your cellular machinery just to basically producing proteins that will in turn stimulate the immune response.
Wow, man! I tell you what, there's a couple. I could talk to you about this all day, but one of the things I think about is I marvel at the speed of which this happened, and I think of other diseases and all. I can't help but hope that the emphasis they put on really trying to find out how to stop this thing, hopefully they take some of those principles that they developed in COVID and apply them to cancer or heart disease or cardiovascular diseases in general, or strokes, or some sort of technology or way they went about it that will make some major breakthrough in the the treatment and the vaccination attempt to stop other things. Do you think that that could happen?
Oh, absolutely. The person who actually started this was that found this research was back in the very early 1990s, maybe even late 1980s. Her last name is Karinkska, I think it is, and she was at Penn State. And she basically she did her research in obscurity for a good decade, and because just all of her colleagues just didn't really respect what she was doing. Well, the problem back then is it's messenger RNA, so when you injected it into somebody, your body's immune system just immediately attacked it and destroyed it.
Wow.
Now they've got it where they can encapsulate it in a lipid layer, like a layer of fat, basically, and so then it can make its way in and it can actually do what it's supposed to do. But over time, people figured out how to fix that problem. And they figured out how to fix other problems. So whenever you hear people say, well, they just come up with this thing in the past few months, I'm concerned about its safety. Well, this technology has been studied back for, 30 years. And this was just a perfect opportunity to use something that we had. It's kind of like having something on the shelf that you can pull in and use. Yeah. And it's going to be used for other vaccines. It actually has, for neurodegenerative disorders, it's going to have some potential impacts in the decade or so to come, and with cancer, too. There's even some discussions about them using it with heart disease, chronic heart disease and heart failure. So,
wow. I'm encouraged by that. Now I want to get to the safety of it.
Sure.
Getting rid of all the conspiracies, the rhetoric you hear on social media, Twitter, Facebook, Instagram, and Bill Gates and population control. You hear all these things. You are a doctor. Well, tell everybody really quick what your area of expertise is as a medical doctor.
So by trade, I'm a neurologist. I trained at the Medical College of Georgia for medical school, and I was at the Mayo Clinic in Jacksonville for my postgraduate medical training. And currently I serve as the director of the stroke program, and I am a practicing neurologist. In fact, I went up and saw some patients this morning prior to coming here.
Okay.
And in addition to that, I'm also the chief medical officer of the hospital, which means that I'm responsible for sort of the overall policies of the organizations as they pertain to the medical care provided. And I also advise the CEO on medical concerns so we can give him some guidance on how to properly allocate resources.
So in your highly qualified, professional, qualified opinion, do you have any reservations at all of taking this vaccine?
I do not.
Okay, so you're going to be first in line, so to speak, to get it. Yeah.
No, I literally plan to be, unless somebody else beats me to the punch. But I will be, and it's interesting that you say that, because when the company Moderna was doing its trials, they did they started their first person on July 27th, and it was actually a media person. It was a news anchor named Dawn Baker, who was in Savannah, Georgia, that took the very first trial dose up there, and of course she did okay. When you look at the statistics behind this, and you look at the statistics behind COVID-19. Yeah. We've seen what this does to people in the hospital. We've seen people on the ventilators, and unfortunately, I've seen people who have passed away from this.
I know.
But what we know that with this vaccine is that not only does it prevent it in the majority of people, but even for those people who do actually contract COVID-19, it is very unlikely that they will end up having severe illness. In fact, out of the two trials, only one out of I think it was one out of a total of about a dozen people that ended up actually contracting the disease, so to a severe degree. So I'm very much in favor of it. About 10 to 15, and that is one thing that I want your listeners to understand, is that it is a 2-dose regimen. You get the first dose, and then depending on whether it's the Pfizer or the Moderna, about 3 to 4 weeks later, you'll receive the second dose.
Okay.
And the important thing that I want them to understand is when you receive the first dose, your body will likely have an immune response. You'll likely feel maybe a little bit of achiness. We know that about 3.8% of people will have some fatigue. 2% of people will have a headache. There's some people that feel achy, maybe even a mild fever, but this will respond to treatment with over-the-counter Tylenol or Motrin, and it resolves within about 24 to 48 hours.
Okay. And then the second dose that you receive, would there be any noticeable side effects associated with the second dose that you know of?
It can also occur with the second dose.
Okay.
And the reason I want to warn people is that when they get the first dose and that occurs, I don't want them to be
You don't
dissuaded.
want them to panic and think,
At this point,
Lord.
you're halfway home. You might as well go ahead and get your second dose, right?
Yeah. Well, I was going to say, you don't need to get one and not the other. That wouldn't make sense. It wouldn't be effective. Looking at the South Georgia Medical Center numbers, I follow them daily. And, last week I saw that they remained in the low 20s, I think it was. And then over the weekend or the past few days when I got back off vacation, I pulled it up, and I'm a little bit concerned because you're up to 42 as of the last report. Roughly, and we don't have to know exactly, but are those mostly or not mostly Lowndes County patients?
Most of them are Lowndes County patients,
Okay.
but there are a percentage that have been transferred in from some of the surrounding counties. Mm-hmm. Of course, South Georgia Medical Center is the destination for healthcare services that can't be provided elsewhere, and so we have a policy that when people call, we do everything we can to try to bring them into the hospital.
I gotcha.
And in fact, I received a call last night that there was an outside community where they had a patient that was very ill and needed to be sent in for treatment, and we're very tight on beds, but we accept them.
Yeah.
We take them.
Yeah.
I mean, that's the bottom line. We won't turn away service at all if we can help it in any way, shape, or form. And even when we're in that situation where we're on what they call diversion, which is something that rarely occurs, but when it does, even then, if somebody has a heart attack or a stroke, we still will accept those for treatment.
Okay. As far as ICU beds capacity, are you feeling good? Are you nervous? Are we related to where we've been in the past 6-7 months? Are we okay? Are we tilting towards getting alarmingly high? Or where are we at in the ICU?
I wouldn't care if we had 1,000 ICU beds. I'd want another 1,000. That's how my mind kind of thinks. It's kind of like money. You can never have enough.
That's right.
But we've been tight on both ICU beds and with some of our medical surgical beds. But we have an active capacity management plan. Randy Smith he's our chief operating officer and chief nursing officer. He holds a dual role. And he's been working along with other members of the team to be able to get people appropriately dispositioned throughout the hospital to be able to move people around. We do have the advantage at South Georgia Medical Center that we're a system. And so we do have a facility in Berrien County and in Lanier County, and we do have some beds out at Smith Northview Hospital, which has been a true godsend. Yeah. For this community, because then we've been able to take people that are less ill in many cases, or they have some specific issue that they're dealing with that we can treat in those facilities to open up some more of the beds that we have in the main hospital if need be.
I had I'm going to say the pleasure, I don't know if that's the right word, I guess, but I had the pleasure of experiencing the drive-through testing services out there after possible exposure right here at the studio several months back. And I just want to give a shout out to that group of folks out there. They ran a really good, really organized thing. I was taken aback when I pulled up at the number of people going through there to get tested. But the experience was quick. It was easy. It was painless. I mean, they did the throat swab, and I got my results via email or through the portal. I can't remember. I think they sent me an email, and I looked, and I got the good news that I was negative. But you guys are doing a great job out there in the testing, and I just want to make sure you relay that thanks and that praise. Also, you guys have a patient that's near and dear to me in the hospital right now battling COVID-19, fighting it. He's 96 years old, David Dennis, my very good friend Sam Dennis, friend of the show. We just hope and pray that he can whip this thing. I know he's in a fight, and I know it's tough, and I know you guys, I know you and Erica, you guys are exposed to it every day, and I know it's just a burden knowing that. I can't imagine how you feel getting up each and every day. Number one, going in and seeing those folks suffer and fighting, and then knowing that you're going into harm's way, and I commend you for that. And I know you guys do everything you can. you take every precaution, but you're in there, and to go do that, it says a lot about you as a person and as a healthcare provider. And you too, Eric. And I know you do a great job on keeping the hospital informed of what the public thinks and keeping the public informed of what the hospital thinks. And anytime I've ever needed anything, you've readily provided. And we don't get you on air as often as we should, but I do appreciate you this morning too.
Well, thank you, Steve. Right. We appreciate you.
All right, good deal. Dr. Dawson, keep us posted on the vaccine, and if I can help in any way, spread the word or get the truth out there and let everybody know how valuable that vaccine is, how safe it is. You let me know, and I'll get you right in here.
I appreciate it. I really do. Thank you, sir.
All right, y'all have a good day. 105.9 WVGA. We'll be right back.